Diabetic foot. Diabetic foot, what is it? Diabetic foot is any pathology that results directly from peripheral arterial disease, PAD, and/or sensory neuropathy affecting the feet in diabetes mellitus. Foot problems are common in diabetic patients. They can happen over time when high blood sugar damages the nerves and blood vessels in the feet. The nerve damage, called diabetic neuropathy, can cause numbness, tingling, pain, or a loss of feeling in your feet. How do diabetic feet start? How does diabetes cause foot problems? Foot problems are common in people with diabetes. They can happen over time when high blood sugar damages the nerves and peripheral blood vessels in the feet. The nerve damage, called diabetic neuropathy, can cause numbness, tingling, pain, or a loss of feeling in your feet. What part of the foot hurts with diabetes? When you have diabetes, high glucose levels in the blood can damage nerves and blood vessels. Because the nerves and blood vessels supplying the feet are so long and delicate, the feet, and especially the toes, often get affected first. Why is foot assessment important? A thorough foot examination is important to detect the disease early. Screening for peripheral neuropathy and peripheral arterial disease can help identify patients at risk of foot ulcers. How can I prevent diabetic foot ulcers? Tip number 1. Check your feet daily. Touch and inspect the skin on your feet and lower legs each day to watch for any scrapes, bruises, or swelling. Tip number 2. Don't walk around barefoot. Tip number 3. Wear shoes that fit properly. Tip number 4. Get the right nutrients. What are signs of diabetic feet? Tingling, burning, or pain in your feet. Loss of sense of touch or ability to feel heat or cold very well. A change in the shape of your feet over time. Loss of hair on your toes, feet, and lower legs. What are 3 things you should never do to the feet of someone with diabetes? Avoid soaking your feet, as this can lead to dry skin. Dry your feet gently, especially between the toes. Moisturize your feet and ankles with lotion or petroleum jelly. Do not put oils or creams between your toes, the extra moisture can lead to infection. Why do doctors look at diabetes feet? People with diabetes need to check their feet often because cuts and other injuries to the foot could lead to infection and, in extreme cases, make it necessary to amputate. Why can't diabetics soak their feet? Also, don't soak your feet, that can dry your skin. Calluses occur more often and build up faster on the feet of people with diabetes. This is because there are high-pressure areas under the foot. Too much callus may mean that you will need therapeutic shoes and inserts. Let's continue later. If you like my video, please share and subscribe.